This is Taylor Watts. Today I will be talking about an article titled Soldiers with Traumatic Brain Injuries Have High Risk of Mental Health Disorders, University of Massachusetts finds by Emily Sweeney in the Boston Globe, published on January 29th of 2020. The research conducted in this article was a retrospective cohort study by David Chin, an assistant professor of health policy and management, and co-author John Zeber, an associate professor and program head of health policy and management at the University of Massachusetts Amherst, whose study was the largest longitudinal cohort of the military. The research was performed by analyzing the records of 4,980 military members and following their care for a median period of 4 years, while earlier studies had only followed them for a year and only looked at one or two branches of the military. The members in this study were a member of the Army, Navy, Marines, and Air Force who were severely injured during combat operations in Iraq and Afghanistan between February 1st, 2002 and January 31st, 2011. The data sets were constructed using several Department of Defense assets like the Trauma Registry, Armed Forces Medical Examiner System, and other data sets maintained by the Defense Health Agency. They used the social security numbers of the members to link unique subjects across datasets and multiple clinical encounters. Chin and Zeber included members if they were injured in combat, received critical care in theater, and survived at least 90 days from the injury date. Service members who sustained more than one critical injury episode during multiple combat deployments were excluded from the analysis. Patients with a mental health diagnosis that preceded the injury date were excluded from the corresponding analysis. The study found that nearly one-third of the soldiers studied suffered moderate or severe traumatic brain injuries, and overall 71% of the severely injured soldiers were later diagnosed with at least one of 5 mental conditions. These conditions included post-traumatic stress disorder, anxiety or mood disorders, adjustment reactions, schizophrenia, and other psychotic and cognitive disorders. Diagnosis for every mental health condition was higher among the cases of traumatic brain injuries. The central takeaway from the study was that severe TBIs are associated with a greater risk of mental health conditions. They were also able to find that the risk for PTSD is higher among soldiers with more severe TBIs, while previous studies assumed it was lower, due to the common belief that having a severe TBI resulted in an anesthetic effect on PTSD, which the data from the specific study showed the contrary. I found the study in this article to be very interesting and informing, as it brings more light to struggles that service members face day to day. This study went beyond most and looked at multiple branches and followed their progress for a median of 4 years, whereas others only looked at one service branch and only followed their progress for a year. I like that this study also looked at multiple health disorders. Most of the articles that I was finding on this topic only looked at PTSD. As stated in the article, the Defense Department has reported more than 375,000 incidents of traumatic brain injuries between 2000 and 2018. Therefore, this study can be applied to continue providing and bettering help offered to military members struggling with PTSD and other mental health disorders. Little is known about the effect of severe physical injury, particularly in moderate to severe traumatic brain injuries, on their mental health among combat-injured military personnel. It could also be used to help better the gear that the soldiers use day in and day out while they're on deployment.